Welcome back. We are going to talk to you guys about the two most popular packages in this open enrollment season for under age 65 business. I have put them here on the board so that we can kind of talk about it in just generality. We're going to try to keep this video around 10 or 15 minutes. And then the next video that we'll do, we will show how to do premium calculations, okay? So today, this is about philosophy and explaining what you need to know so your customer understands. You've heard me talk about pivot, position, and transition in a lot of the videos we've done. The pivoting is basically just talking to your client and saying, hey, I want to build a great package of protection for you. Before, when you were working, you had an HR person that picked all your benefits. What we're going to do together is pick the best benefit package for you. Every open enrollment, we're going to reevaluate your needs. We're going to reassess your budget. We're going to make sure you're well taken care of. But the most important thing you need to get across to your client is if you're going to do ACA, it's a 12-month plan, okay? Use the terminology 12-month plan. That's the legal terminology because that's what it is. So if your client is going ACA or short-term medical, depending on if they can afford it or if they're getting free government coverage, whatever the case may be. If you've been in the under age 65 market at all, you know exactly what I'm talking about here. So you go to ACA, you go to healthcare.gov, or you may be doing Health Sherpa or some other portal out there. You're going to find out my client gets free coverage. Whoopee, wow, that's exciting. If that's the case, they don't need short-term medical. Because short-term medical is not, in all of the sense of the word, guaranteed renewable. There's a lot of companies out there offering 3-year terms, but it's each year, and those have rate increases based on inflation and attained age, and they're not permanent protection. So a lot of you have heard my videos already about permanent protection, which is also your paycheck protection. The more persistent the business is, you get paid. The carriers are paying you. The clients love that situation because they're not having to pay you a fee like they would a stockbroker or a CPA or a financial planner. You're being paid because you've studied and you're advising your prospect properly. And we're hoping that this prospect turns into a client, okay? So we're either going to go one of these, then we're going to build in an affordable choice, which a lot of us call Obamacare alternatives, or sometimes it's called a Lux hospital indemnity, meaning it's paying a great deal of money per day while they're in the hospital. And those are cash plans. So they get to negotiate cash with the provider, okay? So we're going to add that in. If they've got free coverage, we may want to, on the affordable choice, say, hey, we can do a couple of different things. We can either put you at the higher level because you're getting free insurance, and next year, if you're in that situation where you don't get free insurance, you at least have a really good plan that you've already qualified for, and guess what? You're past your 12-month pre-ex. So unlike the government plans that are 12-month plans, once you get them in affordable choice, those are permanent. They're guaranteed renewable. And you really need to explain to your client what guaranteed renewable means. It's real simple. As long as you pay your premium, you're going to have protection. It's that simple. So we put affordable choice in here depending on their budget. Remember, the more you save your client, the more you diversify their dollars. A lot of these people watch Susie Orman. A lot of these people watch Dave Ramsey. What you've got to make sure you do is you invest their dollars wisely. You're not a financial planner here, but you really are. You're taking their health dollars and you're diversifying them. So I like to call that a health insurance planner. It's simple. You don't get into the world of finances. All you got to know is health insurance. And they are so simple to explain. I always say, you pass the insurance exam, you should be able to read, and know what your product does. You're not always going to know what every single product that's in your arsenal pays for every single thing. That's okay. IDK is totally acceptable. I don't know that answer. Let me check on that really quickly and find it. You have resources. Check with your FMO. Check with your carrier. Read. You know, that's what you're paid to do. You wouldn't be paid what you're being paid if it were super easy, by the way, because that means anybody could do it. So you need to really do your homework and your research. Now, after we've done affordable choice, Manhattan Life has a great out-of-pocket protection plan. I prefer affordable choice. Y'all have heard me say it time and time again. They defended these type of plans, so they have my loyalty. End of story. And at the end of the day, they also have out-of-pocket protection. When you layer these two together, sometimes your clients can walk out on day one with almost 12 grand. 12 grand, that's a lot of cash to negotiate with a hospital provider. That's a lot of money. A lot of money. We've talked about the average claim. If you've not researched that yet on your own, go research it. I'm going to give you stuff to help you. But I also want you to be that person that says, hey, I found this on Google. I found this in Forbes magazine. I found this in Money magazine. I found this in the New England Medical Journal. You need to be able to educate. Take yourself out of that sales role. Take yourself out of that quick pitch role. If your clients wanted quick pitch, they would call the nearest telecenter. They want you. And if you work in a call center, you still need to be educational. As a matter of fact, you need to be even more educational than the person face to face, because you're having to overcome two types of credibility. You're having to overcome that you're not this rogue call center, number one. And number two, you're not in person. So you need that education for your credibility. Next, income protection. Why are they called income protection in the under age 65 market? So many people under age 40 do not have 6 months of income saved. Google that stat. That will give you conviction on these dollar-a-day plans. And when you get past out-of-pocket protection, you want to try to keep your premium as close to $1 a day as you can when quoting. Now, your client, because of their needs, because of somebody they know that had cancer or a heart attack or stroke or a major accident, they may say that's not enough. They just told you what you needed to do for them. So many agents' biggest mistake is they miss buying signals. Your client is asking you for knowledge. And when I hear an agent say, okay, have a nice day, that basically means there was no business transacted. When I hear an agent say, thank you for trusting me, thank you for doing business with me, business was transacted. It meant you were interesting. It meant your client trusted you. It meant your client liked you. And if you're just starting out with the bundle and you're insecure about the way to go about this, a callback is not bad. It's probably not going to get you what the client really needs when they need it. And what you don't want, and you share this with your clients, guys, share this. All these plans cannot be sold when the house burns down. Only ACA can be sold when you're sick, but only one time a year, or if you've had a special enrollment period. Like I've said, open enrollment ran a long time this year. But what I really want you to understand is trying to get your customer satisfaction level where it needs to be. Once you've got their satisfaction level where it needs to be, you've engaged the trust. Now y'all have a relationship. Now y'all have a partnership. And they're going to call you when they need to drop something because they've got a budget constraint. Okay? So here's what we want to do next. We want to add accident, and then we want to add DVH. For those of you that go, oh my gosh, they're going to pay this and they're only going to get this amount of benefit, you've got to remember, when you have 2.2 kiddos in that house, 2 dental claims could wipe out a month of income. So we've got to think for our client as if we were the client. And then life insurance, this is not a Med Advantage situation. This is an under age 65 situation. There's nothing that says you can't talk about life insurance. You need to work on life insurance. And if you are into annuities, my friend, you call these people back in January and you start talking about their IRA. And that's how they step in with you in a financial situation. They're giving you a small amount of money. They're going to watch that work. And trust me, if they have any other investments that come due, they're going to want you there too. Now, real quickly, if you don't do affordable choice or short-term medical, you're going to quote the highest affordable choice you possibly can. The highest out-of-pocket you possibly can. And the rest is just what we talked over here. Thank you for tuning in. Have a great day. The next one we shoot is going to be actual premium, and we're going to have role playing coming at you, and this is going to keep coming to you guys all during open enrollment. So if you had one of those defeat days, you're going to be able to get up the next day, pull yourself up by your bootstraps, and go take care of your clients. Have a great day, and thanks for tuning in.